Teresa, you had a question about health care for the senator.
Yes, so I am a physician, and as a physician and a healthcare provider, we are on the front lines. And so I've seen many concerning things in healthcare recently, especially. I have a patient who, he works, he has a job, but he cannot afford the premiums that are rising. He cannot afford the $900 a month premiums. He also makes too much money to qualify for the ACA and for Medicaid, and he's too young to qualify for Medicare. So he is literally praying every day that he doesn't develop some catastrophic illness until he's able to qualify for Medicare. I have a patient just last week who told me he couldn't afford his insulin, and he was asking me, what can he do? And insulin, you can't live without insulin if you're an insulin-dependent diabetic. It's a life-saving medication. And I have a lot of patients that are of mature population, and they live on a fixed income, and they cannot afford these rising premiums and co-pays and healthcare costs that are happening. So, you know, I know that you support Medicare for all. How would that work? How would you implement that? How would you get it done?
Yeah. So I believe, as I think most Americans do, that healthcare should be a right and not a privilege. And that means you have to fight for universal coverage that's affordable and quality for everybody. I think the quickest way you get there is you allow anyone to buy into Medicare price they can afford, something like 4 or 5% of income. They buy in, so it's an earned benefit, and they are qualified automatically for Medicare. What that does at a minimum is create competition in the system immediately. Those insurers, I don't think they are going to compete. They refuse to lower their rates. They're pricing people out of the market today, but for the Affordable Care Act, they were dropping people with pre-existing conditions, and under President Trump, they're going to keep dropping people with pre-existing conditions. So the truth is, let's have a not-for-profit public option compete for the business. I think over a couple of years, you're going to transition into single payer.
So I just want to be clear about this.
Yeah.
So you're not saying start with single payer. What you're saying is introduce essentially a buy-in option, and it's possible that private insurance continues to exist under that in a dual track system.
I dare them.
That's okay with you?
I dare them because I don't think they will meet the needs because they're for-profit companies. When your goal is to make money for your shareholders, you are not giving that patient the medicine they need or the treatment they need or the extra day in the hospital they need because it doesn't allow you to make enough money. So I don't think they will compete. So create this not-for-profit public option as a transition. I imagine within a few years, most of Americans are going to choose Medicare because it's quality, it's more affordable. I mean, in your own mind, just think 4 or 5% of income on what you make today. Is that cheaper or not? It's gonna be cheaper. If you make $100,000, it's $4,000 a year. It is cheaper, and most Americans earn less than that. So that would be what I would do because Medicare works.
Rick, you had a question for the senator.
I started my career